I hear from people all the time, I'm sure you do too, I can't afford health care, I don't have proper health care, I can't see a doctor.
Medication.
Yes.
I mean, this is something, so we're talking about access and affordability. You know, I have patients who have insurance and I have patients who don't have insurance, and they're both struggling because sometimes you can have insurance and need a medication or need to see, let's say, a mental health professional, and your insurance won't cover it, or they won't cover the medication that your healthcare provider wants you to be on. And that's very frustrating for people who have insurance. They think, well, why is this happening?
Why do I have insurance?
I'm covered.
Yeah.
And then, of course, the people who don't have insurance oftentimes, not always, are in the same situation. It's a massive problem. It is a huge problem. And I don't think that the way that we're seeing it dealt with is moving the needle as much as it needs to be moved to get people the help they need to get. So my advice to people, which is really hard, is number one, you know, if you have insurance and you have to go for a test or a medication is prescribed that you can't afford, be persistent and be creative. Don't just say, my insurance won't cover it, so I'm just not gonna go. Ask, you know, medical centers or teaching hospitals what resources they have available. With medication, ask if a generic is possible. It's not always ideal. I would use caution when going online to try to get cheaper medications. That can be really problematic. Treating disease is very expensive in this country. That's why, you know, when people say, well, it's so expensive to eat well or it's so expensive to stay healthy, being sick is more expensive.